What's going on? You're so quiet today. What's the matter? You feeling depressed? Not eating well? Losing weight? Well, you know what? I think you've lost just about all the weight you can, so let's see that toothy grin. Hi, I'm Joe Alden, and I'm also known as Dr. Bones, the Disaster Doctor of doomandbloom.net, where you'll find over 400 posts on medical preparedness for times of trouble. I'm also the co-author of the Survival Medicine Handbook, the #1 Amazon bestseller in both survival skills and safety and first aid. This is the famous TD bird, the most awesome bird in town. And of course, there's this guy, my poor depressed friend over here. Changing circumstances, whether they arise from shifts in social settings or result from a catastrophic event or even loss of a personal relationship, require adaptations from the individual. With depression, those changes are felt as losses, and they can be very hard to cope with. This is where you, Survival Medic, can step in to make a difference. This involves developing good listening skills and an eye for when a member of your family or group needs your help and support. Many people with depression disorders also suffer from anxiety, which is the subject of one of our other videos. Since depression makes anxiety worse, and vice versa, it's important to have strategies to treat both conditions. In a collapse, things may be so bad that everyone is depressed to one degree or another. This response to the strain of a survival situation is understandable and is referred to as situational depression. Their circumstances are what have made them depressed, not some misfiring of neural cells in their brain as in some other cases. Some depression is cyclical too, relating perhaps to a woman's menstrual cycle, the weather, or even the time of the year. Like anxiety, depression has a number of symptoms that are commonly seen in various combinations. Feelings of hopelessness, feelings of inadequacy, apathy, change in appetite, weight loss or gain, irritability, especially common in men, exhaustion, reckless behavior, difficulty concentrating on tasks, aches and pains without a clear physical cause. Now, severe cases of depression are marked by an inability to get out of bed in the morning and even thoughts of suicide. Various medications known as antidepressants are available on the market, including things like Zoloft, Prozac, Paxil, among others. Unfortunately, they'll be unlikely to be in your medical supplies unless a member of your group already suffers from chronic depression. As such, you have to look to alternatives, natural alternatives. Vitamin supplements such as B12, folic acid, tryptophan, and omega-3 antioxidants may be effective in some sufferers. St. John's wort has been used with some success, but is not to be used in pregnant women or children. As with anxiety, you, as a healthcare provider in tough times, will have to depend on your counseling skills mostly to aid your patient. In situational depression, as will be seen in survival situations, you are going to return to many of the techniques used to treat anxiety. These are assuring good nutrition, reducing substances such as nicotine, caffeine, and alcohol, encouraging exercise and constructive activities, promoting rest breaks, and promoting good sleep habits, so important. Instituting relaxation techniques, meditation, massage, deep breathing, maybe a little hippy-dippy for you, but believe me that they really work. Now, additionally, it's going to be especially important to make sure your people cultivate supportive relationships with each other. People who are depressed often feel very, very alone. You have to work to foster a sense of community. This will provide strength to your emotionally weakened members. Now, make sure to accentuate the positive even in the little things. Encourage each member of your group to share their feelings with others. Group meetings for this purpose especially will encourage communication and bonding in the survival group. Incorporate these meetings as a regular event. You might have read about post-traumatic stress syndrome, PTSD. This condition affects many who are exposed to stressful events like sexual assault, combat situations, or natural disasters. Relapses are common in this situation and can last for years. In these cases, the patient will re-experience traumatic events mentally. They may become agitated and perhaps uncontrollable. Anger, insomnia, decreased work performance, and apathy are common manifestations. Although anxiety is also a component of PTSD, anti-anxiety medications don't seem to help as much as antidepressants from at least a pharmacy standpoint. Now, the success of your survival group is going to depend greatly on your ability to spot these emotional issues before the situation deteriorates. Once out of control, these conditions will damage the cohesion necessary to succeed in an adverse environment. Handling depression among your people will be one of your most difficult challenges. Close observation and quick intervention are skills as important to develop as any specific technical skill in a survival scenario. This is Joe Alton, MD, also known as Dr. Bones, wishing you good health in good times or bad. Thanks so much, guys, and make sure to check out doomandbloom.net. Thanks again. Say bye, TD. Bye-bye.